Hi, welcome to ParentingU, where we help you navigate this amazing journey we call parenting. Today, we welcome Dr. Karli Boggs, an OB/GYN with Our Lady of the Lake Physician Group, to talk all things girls, puberty, and first periods. We also welcome Dr. Brett Hutchinson, a pediatrician, to talk with us all things boys' puberty. It's a great episode, so I'm ready to get started. Welcome to ParentingU, Dr. Boggs.
Thank you so much.
Why don't you start telling us a little bit about yourself? What do you do? How long you've been practicing?
Okay. Yeah, so I am a board-certified OB/GYN. I have been with the lake for almost a year doing solely GYN practice,
Yeah.
meaning non-pregnant women's health care. And during this time in the last year, I've also started an adolescent clinic at Children's for
Wow.
adolescent gynecology. I am born and raised in Louisiana. I went to LSU undergrad, LSU New Orleans Medical School. Actually did my training here in Baton Rouge at Women's Hospital. And then after residency, I was faculty for 4 years. I worked at a community clinic for 2 years after that, and I've been here at the lake, like I said, for about a year.
That's awesome. So you know
Yes.
what you're doing.
Yes. Yes, it's my passion.
Well, and I'm so glad you're here today. I was telling you off mic, I'm selfishly really excited about this episode because, as I've mentioned here before, I have 2 daughters, one who is 10, the other who is 7. So we're right on the cusp of puberty. So this topic is really relevant. And I know a lot of other moms who maybe didn't grow up with as much information as we have now and weren't taught appropriately. So being open and honest about these things is so cool to me. So thank you for
Absolutely.
being here.
Yeah, happy to be here.
We'll just start with the big stuff. Give
Mhm.
us an overview of puberty in girls, kind of what to expect, what are your typical signs, what do we need to know?
Yeah, so puberty is the transition from childhood to adolescence, and it is a long-term process that affects essentially every system in the body. And it's in girls, usually the first sign of puberty onset is breast development. What we also see after breast development can be hair development, so underarms, pubic hair, as well as kind of change in body shape and growth spurt. Then usually the next stage is menarche or the beginning of a menstrual cycle. Along with all of those things are also changes in your skin, acne, emotions. The brain development during puberty is something that we don't usually focus on as much because of all of the body changes. But the brain is rapidly developing and changing, and that is where some of, the moodiness and the emotions up and down changes really start to show and develop.
Interesting. Yeah, you don't hear about the brain stuff as much. And so tell me a little bit more about that. Is it mostly because is it growing? Is it connecting? Is it forming more synapses? Like what is it that's kind of throwing everything off?
So the hormonal changes as the gland in the pituitary gland in the brain starts to develop and transition some of the hormones, as well as there's a place in the brain called the amygdala, which is kind of the front part of the brain where your sense of being rational and controlled and safe and tempered is really still trying to develop. And so it's during that adolescent phase where all of those changes happen. Children are also trying to learn some of their independence and trying to be separate from their parents and figuring out what all of that looks like and feels like and how to navigate that change is difficult for children or adolescents as well as for parents.
Yeah.
Yeah,
Yeah.
I mean, I have 2 girls myself. My oldest is about to be 9, so I
Yes.
can sympathize with what
Yes.
the questions that you have.
Yes. Don't be mad at me if I ask for your cell phone number after
Anytime,
this.
anytime. Yes, yeah.
Well, it's funny you mentioned the amygdala because we had an episode with Dr. Klinkingbeard about driving, and he talked about making good decisions and the development of the amygdala. And in teens, later teens, it's still not there. So this is
Yes.
kind of the kickstart of all of that.
Yes.
When would you recommend the right time to start talking to your daughter about these changes to come?
So it's all individualized. You know, as a parent, your child better than anyone else. You know their maturity level, their ability to take on some more complex thinking and acknowledging what's going on with their body. I think it also depends on if you have older siblings or older cousins that are starting to see things. I feel like if you have that example nearby, they may start asking questions a little bit earlier. But if they're the oldest child, first grandchild, really the first one to go through everything, then usually around 7 to 8, closer to the 8-year-old side, I would say really kind of starting the conversation in very basic terms. And what I really recommend is to be curious and let your child be curious. Have them ask questions and feel comfortable for you to be the trusted adult that they can go to with their concerns. But around 8, starting some of the conversations about the body would probably be the beginning. The average kinda age of breast bud development is around age 8 to 9, with the first cycle or menstrual cycle starting about 2 years after that. And so once you start seeing some breast bud development, you know the direction you're going, and can start having some of those basic conversations.
And I like how you say conversations, plural, because I think our generation growing up, there was one talk,
Yes.
maybe, if that.
Yes. Yes.
So talk a little bit about kind of the ongoing conversations you need to be having. It's not a one and done.
It is not a one and done, and that's an excellent point. Yes, I would say myself, and this sounds like you as well, it was kind of, everyone knew the talk was coming. It was a lot of anxiety for the parent, a lot of anxiety for the child because they'd heard things at school, and then it's coming. This is more of multiple conversations about things you're noticing. Maybe you're wearing an outfit and you're noticing some breast bud development. Talking about, a sports bra, training bra, that type thing. Then do we talk about hair development? Do we talk about acne? Do we talk about the first menstrual cycle? Talk about your height, change in your body. Those are all progressive conversations. I'm a big fan of being proactive, not reactive. And so in doing that and really kind of setting the stage of everybody's different. This is your own path, your own journey. You're going to be doing this at your own pace. There's not a right or wrong in any of it. And I'm here to answer any questions you have. I think is the best kind of segue into it so that your child feels comfortable coming to you with any questions because none of this happens overnight. It's not a light switch, it's a process and it takes years. So starting young in that 7 to 8-year-olds, kind of about the body conversations, um, make it, a regular check-in. "Hey, how are we doing? What are you noticing? Any
I
questions
like
that you
that.
have?"
I like
Mhm.
that. Well, and how would you recommend the parents prepare themselves to have conversations that even they may think are embarrassing?
Yes. So, I think that's a big part of it, because if you don't feel comfortable having that conversation, your child's going to pick up on that. So reading ahead of time, there's a lot of really good articles online. I would say be very cautious and careful about the resources you have. So American Academy of Pediatrics has a healthychildren.org, which has a lot of resources and information about changes of all different ages. And then healthygirls.gov is by the Office of Women's Health, the U.S. Health and Human Services Department. And it's specifically about girls' transition and all of the different questions they may have. So as the mom to or the parent to, research that information, know what you're talking about is really important. The other is we've all been through this, right? So I think being able to share with our child our own experiences is something that validates it for them. They don't need the data, but you as a parent need to make sure that what you're saying kind of tracks because what you experience may not always be normal, but so we need to validate that. But the other side to it is we need to share our experiences with our children so that they know they're not alone in what they're going through right now.
So I want to kind of focus in on the topic of their period for a little bit. When should we start? You mentioned kind of around 8, talking about the body, but as they kind of prepare for their first period, how can we kind of get them ready for that? There's different ways we've seen online about, you have kind of a little pack ready to go if it happens at school, or you have a little card that you can give to the teacher or to the mom if you don't want to say it out loud, what would you recommend as far as preparing them?
So, just like I mentioned earlier, be proactive, not reactive. So, talking about that around age 8 to 10, kind of based off of whatever your child is presenting, um, and really letting them know that there's nothing bad, it's nothing scary, it's nothing dangerous or abnormal. So they if it happens and they've never heard anything about it, they don't think something bad is about to happen to them. In terms of communicating with parents, girls sometimes are very embarrassed by that. Again, we talked about the emotional development that goes with puberty. And so there are, good ideas of sharing a card or some notification. I would encourage everyone to be able to have that conversation with their child. But if you don't feel like, one of my daughters does much better communicating via writing than she does talking. And so if she gets upset, she will write me something. And that's just who she is. And so acknowledging that, recognizing that, and knowing that she can write something to me and encourage them, I know you don't want to talk about this and it feels kind of funny. So why don't you write down those questions that you have or about some experiences or things you've heard and write them down and I'll write something back to you so that they don't feel as um,
Intimidated.
yes, intimidated in the moment of having that conversation, but they still get the information that they need.
That's great. That's great. I think, I've also always heard, go in the car because you're not face to face, you're kind of side by side. So having kind of tough conversations in the car can be that way too. What would you say to parents who want to have this conversation with boys? Like they may have brothers or cousins or friends at school. How do we prepare our young boys to know that this is happening so that it doesn't become something they're afraid of or make fun of girls about?
Yeah. No, I absolutely think that that's a conversation that should be had with boys as well. Because it's the fear and the lack of knowledge that breeds questions and shame and concern. And so if they know what's happening, they don't need to know the ins and outs or all of the mechanics at that age. But they need to know this is a normal part of life. And this is not something that we should talk badly about or be worried about. This is normal that your sister, cousin, friend will be experiencing at some point. And if you have any questions, let's talk about it because it happens to everybody.
Well, on the topic of boys, we know that they are going through their own transitions and changes and development. And so we have brought in Dr. Brett Hutchinson, a pediatrician, to talk specifically about what they're going through and how we can support them. We're happy to welcome Dr. Brett Hutchinson, a pediatrician with Our Lady of the Lake Children's Health, to talk all things puberty and boys. Welcome, Dr. Hutchinson.
Thank you.
I'm much less familiar with puberty for boys. I have two daughters. I myself am a female. So really wanted to get your perspective for our boy parents out there on what they can expect as their sons enter puberty, what to look for, what are the stages. Just give us a little bit of an overview.
Sometimes it can seem like puberty's coming even when there aren't physical changes, some behavioral differences that might even start showing up a year or two before physical puberty happens. So the nice little innocent child starts to have a little bit of a talk back answer or a little change in their mood and outward mindset, and sometimes that really is the very beginning stages of puberty. Hormonal changes start to happen before physical changes, and sometimes that's out in front. I mean, it's not unusual for parents to say, come in with a 9-year-old, and they're like, "Are they starting puberty because they're acting a little different?" Like, well, physically no, but yeah, just get ready. And then the physical changes start. I mean, that's what most people kind of recognize as a start of puberty. For boys, it can actually be a little less noticeable because the true first starting physical change of puberty is testicle size, and that's obviously not something that's readily visible. Pubic hair is of course an early sign, but not underarm hair. So some parents will say they don't have any underarm hair, so they hadn't started puberty. No, that's actually farther into the process, so that's not something to look for to start. Um, Growth spurt is another common thing that people come asking about, and there are subtle increased growth rates that are happening at the beginning of puberty that aren't the noticeable 4 inches in a year growth spurt that comes a little bit later. So, voice changes, that's another one that people are looking for with boys, but that's not something that happens right at the beginning. Um, or some things that a few other things that are probably more noticeable in the beginning, acne. So the very beginning of not the big angry pimples that older teenagers hate, but just the signs of some bumps on the face that weren't there in the last 6 months or year prior to that. Body odor. So teenagers, boys and girls, but it seems to be more noticeable in boys. Preteens, pubertal children. You start to sweat more. The sweat has more oil, and so that leads to more body odor. So sometimes that's parents' first guess is like, ah, you smell like a teenager now, and you're not even a teenager. Yeah. So those are some of the signs and some of the early signs.
I'm curious, why does a boy's voice change? What's happening that's so
Yeah.
noticeable?
So there's actual growth and reshaping around the vocal cords that is nature's way of making masculine characteristics, if you could say. But there are testosterone is part of that, and so since boys maintain a higher level of testosterone than girls, you get more changes there. But yeah, there's actual physical change to the voice box, the vocal cords. Why boys have Adam's apples and girls tend to not. Some of the growth in that same area.
Okay, good to know. Well, you mentioned the parents begin to notice things and then may get scared themselves. How can you reassure parents, or what would you say to parents to support them that so that they can support their tween during this time?
Yeah. So one of the first things, just as you alluded to, is for the parent to be ready. Okay. So because the kids aren't ready usually, or they don't know what to expect or how they're going to change. So the parents have to be ready to deal with it. Part of that is a lot of reassurance. So as the body starts to change, most preteens and teens become very body conscious. Sometimes an early sign of that is the child who the parent could bathe them or be around in a bathing situation, and now the child is expressing modesty, doesn't want people in the bathroom when they're bathing or when they're changing clothes. That can be an early sign. So being supportive of those type things when the child starts to express some differences in how they wanna be in those situations, being supportive of that to the parent. Um, Children as their bodies start to change have a lot of self-doubt. Teenage and preteen years are, there a lot of peer pressure and not even if not peer pressure, just wanting to fit in, wanting to establish themselves, and therefore having a lot of doubt if they're different at that stage than their peers. And so reassuring that I know that a common boy example is all the other boys have gotten bigger faster. And so a lot of reassurance to a boy if he's not growing yet or not growing as fast as his friends, that you're still normal, you're still gonna be as big as they are physically, like that's all coming. It's just not happening for you yet. Um, Trying not to have even good-natured picking on physical features and things with kids at that age. I mean, some kids would handle it well, but some kids are gonna be a little sensitive if you tell them that they smell really bad because they haven't put on their deodorant today. So, just being careful about that type language too. And then ex trying to help a young child or a early adolescent child, an early pubertal child understand that they're feeling things that they've never felt before, emotions at an intensity that they haven't felt before, and letting them know that that's normal, that's happening, but you have to be ready to learn how to deal with it. Telling that to the child that yes, you're going to feel extra sad, extra angry in ways that you didn't feel before, and you have to be able to talk about it.
Well, and are there any signs or changes that we should worry about? When should we talk to the pediatrician if maybe we don't think that they've started puberty, or we've seen a really high spike in something, whether emotional or physical? What are some maybe signs of that we should be looking out for?
Yeah, so there are definitely established normals for when puberty should or should not be happening. So we'll just start there. So for boys, The accepted normal potential starting age for puberty is 9. Now that's early, but that's not considered abnormal. So, um, pubertal signs being present before 9 years old, meaning pubic hair that's definite pubic hair, underarm hair. Um, some children do start to have puberty-worthy body odor that's not actual puberty, at early ages, but that would be another sign. So those would be some things that if that were happening before the age of 9, that would be the right, right situation to bring to the attention of a pediatrician. And then on the other end, puberty should be starting no later than by 14. So if we've got a 14-year-old, particularly if it's not I'm gonna call it a brand new 14-year-old. So if it's someone who's well into the 14th year, and we're not seeing the physical signs of puberty start to develop, that would be a concern. Often the clue, more so than true puberty signs, would be growth signs.
Yeah.
So if there are some hormone deficiencies or things of that nature, we will not have had any type of growth spurt or rapid growth increase, and so that often is what stands out. So the range of puberty, of normal puberty, being 9 to 14. Anything that's showing up before that or not showing up by then, those would be the first cues for that part of the discussion. Otherwise, yes, teenagers are more emotional and don't make the best choices sometimes. They can be more irrational or make irrational choices even when they know what the right answer should be. So certainly there's a lot of that to kind of sift through as what's normal and not normal. But signs that something else could be going on, like a mental health challenge that often can pop up during puberty, would be things like withdrawing from family, withdrawing from friends, not being as willing to socialize in ways that usually they had done. And certainly some of that happens with puberty, but it would stand out as being no, this is more than what they normally do. A change in peer group. So if we've always had a certain group of friends, particularly if we've been fortunate enough that the same friends have come up with the child through all stages of school, and we're not at a school doing something brand new where it's a brand new set of friends, but in a situation where we've always had a certain set of friends and now we tend to be hanging out with a different set of friends who maybe we don't like the things that are going on with those friends, the activities we're participating in, that could be a sign. Poor grooming. So lots of teenagers don't love to, for some reason, 12-year-old boys and 13-year-old boys, you have to argue with them, get them to take a shower. That's not what I'm talking about. But all of a sudden you've had a kid who normally didn't have grooming problems, and now they don't want to groom, or now they're being real resistant, which could go hand in hand with not sort of coming out coming out into social situations. Weight changes that are very rapid. So rapid weight gain that's not just from growing taller, rapid weight loss, talks of being unhappy with their body and therefore trying to go on to some type of diet. Those can all be signs of concern, that there may be reason for concern with something that's evolving in the pubertal years.
Well, a couple of random questions.
Sure.
Are growing pains real?
So they can be for some kids. For some kids, they very much are. Some kids never experience them, but there are a couple of hallmarks that should be present if it's true growing pains. In a 24-hour period, the time when a body is truly growing the most is overnight. So growing pains classically should be in the nighttime hours, in sleep time hours. And then the biggest bones are usually the targets for growing pains. So one of the most common, if not the most common, is in the upper leg, so in the femur. But leg pains that are below the knee could be okay too. And then the other thing is growing pains should respond to either some Motrin or Tylenol basic treatments, or in younger kids, I call it a mommy massage. And I can wake up in the middle of the night, my leg's hurting, mommy rubs it and it feels better. Okay, that's good. And then growing pains should never limit us from activities or limit daytime activities. So we shouldn't have a child limping or not able to participate in a daytime activity just because it's growing pains.
Is there anything different nutrition-wise, sleep-wise, activity-wise that tweens going through puberty should do?
Teens and tweens, especially as they get to the phase where their growth rate is really increasing, do need more sleep. So it can be true. It's not universal, but it can be true that a 13-year-old might need more sleep than a 10-year-old because when a body is growing rapidly, it needs more rest. The other thing that's true of teens and preteens sleep related is physiologically their body actually wants to sleep at different hours. So it is actual physiology that a teenager's body would tell them go to sleep at midnight and sleep till noon the next day, like often is done on the weekends. But that doesn't conform to the way we need to function in society. So that's why it can be a struggle for some kids more than others, though, to have trouble going to sleep at night, to be a real pain to try to get up in the morning. So those are real things. When bodies are growing faster, they need more calories. So it's not unusual. And since we're on boy topic in particular, it's not unusual for the teenage boy to be able to eat a whole pizza or eat 2 or 3 hamburgers, and not gain the weight that we would as adults if we tried to do something like that. So understanding that can happen and be okay, trying to encourage or make it so that the extra eating that teenagers do is in good food and not just hamburgers and pizza. But the body needs a lot of protein. And so sometimes that eating comes from the body saying, no, I need more protein so I can grow a lot. One other thing I would throw in there is calcium, because growing bones are the bones that can take calcium. Our adult bones don't really take in new calcium. So we want to be able to supply a growing body with as much calcium as it can take. Dairy food is some of the only food that does that for us. So I try to ask teenagers a lot and preteens about drinking milk and getting dairy in general, because if we're not getting it from dairy food, there's a good chance we're not getting enough calcium.
That's really good to know. And I appreciate kind of the
saying of, there's a season for everything, and this is one of those seasons, and it may be a season of 3 hamburgers at dinner. But it's serving a purpose, or at least the good food is. How has the conversation about puberty evolved over the years in your experience and in your practice? How are you talking with parents about it? And then are there any myths or misconceptions you want to debunk?
The discussion, I wouldn't say, has changed a lot in terms of the content. Some of what has become more and more true is the availability, the presence of information, and not necessarily in a good way. So, it's always been said to parents that you need to have the talk with your children before they become pubertal, because we want them to be prepared and not have things happening that are surprises. And that is still true, but the access to information is not always helpful. So, most children have access to all types of electronics and all manner of anything based on the internet. So that and then throw on social media and things that are being talked about among their peers. So a stronger call to be more prepared to start that discussion early, not necessarily earlier, but early enough for each individual child. So being ready for that. Again, not a new topic, but something some parents might not think about, and information-wise, is your child might be your oldest child, but their friends who are the same age might have older siblings, and therefore that friend is more exposed to things that would be for older children than your child would be, because he doesn't have that home exposure with an older sibling. So thinking about that, also in the sense of, and I'm not in any way trying to discourage going and hanging out at friends' houses, but at your house, the internet may be safer than in a house with an older teenage sibling where there's just more access to things. So some of that would be a little bit of the change in puberty discussions through the years.
Well, and maybe parents having to get over a little bit of the embarrassment factor about it, and kind of being open to the child and saying, you can't ask me anything that would embarrass me, or that would shock me, or, and oh, if you don't want to ask me, let's talk to the doctor about it.
That's right. So establishing an open communication, whether that be with the parent or with someone else who would be a trusted adult, is part of starting the whole process. From a parent standpoint, it's best to use the real terms, so not to use nicknames. Thank you. Nicknames. So I mean, say penis, say vagina, and from a parent standpoint, you may have to practice saying that when you're not in front of the kids, so that you can say it very matter of factly, because that's the way it needs to come out. Being ready as the parent to explain or describe what either your or your family's values are, and making that very clear that this is how we think it is. This is what we think is important. We don't think it's okay to do these certain behaviors. And some of the kind of change, to go back to the other question, would be maybe the way society has changed, and things that we still think are right as a parent might be looked at by some people as, oh, that's so old fashioned. They don't have to be that way. But if those are your values, those are your values. And you need to make that clear to your children.
Historically, a lot of focus has been made on girls and body image and understanding that, but it's true for boys too, and I think probably more so in this age. Can you talk a little bit about boys going through, being uncomfortable with their body, or you mentioned comparing themselves to others that have grown differently? How can we identify and support our boys as they're going through this?
The scenario that pops in first is the boy who's the late bloomer, who all of his friends have gotten bigger while he's still not quite there yet. But it actually can go the other way. So the kid who's the earliest bloomer, who is shooting up and growing way faster, or growing faster, growing taller faster than his peers, that child can feel just as awkward. In boys, probably from what I observe, the things that stand out for body concerns tend to be height, because height is important in sports. Often boys being just more competitive, often height tends to be the standout. Body hair can be another one. I mean, my friend's got lots of body hair and I don't. What's wrong with me? So a lot of reassurance that if, yeah, your friends have gotten taller, you're still growing fine. It's going to happen. Lots of reassurance for what is normal is going to be part of the answer there. And it may be child specific describing what is normal, but it's okay. Your friend has a deeper voice and you don't. It's going to happen. And some of that may be easier to do from a pediatrician. So I mean, I try to, like, for example, in my visits, I use a lot of growth curve showings to tell boys in particular, because they worry about it more. Look, here you are on the growth curve or chart. You're normal. You can see that your dots fall in line with the graph you just haven't started growing faster when other boys have, but it's going to happen for you. Sometimes I can reassure them that it's starting now. Actually, you don't realize it yet, but you've started to grow faster, and a year from now, you're going to be 3 inches taller, and you're not going to feel as different. But mostly a lot of reassurance that what's happening with your body is still normal is how I would approach that.
And not dismissing it as bad behavior or not manly enough behavior by worrying about that. Just not dismissing that emotion, because it's as prevalent in boys as it is girls.
Absolutely. I hate to go back to the same answer, but just trying to present that normal is not just one thing. That he's normal, you're normal. There's just more than one way to be normal at your age. And just a lot of discussion of the fact that it's a really hard age, because so many different so many different growth rates and body happenings can still all be normal.
Thank you so much, Dr. Hutchinson. I really appreciate all that information.
Happy to have helped.
So let's talk about specifically GYN care. So when should parents be thinking about bringing in their daughter for their first GYN appointment? And then also talk to me about when should a parent, if ever, be concerned about puberty maybe not starting as early as we thought it would?
So the American College of Obstetricians and Gynecologists recommends that the first GYN evaluation happens around age 13 to 15. And that does not require an exam. That is more of a conversation introducing the child or teenager to the world of OBGYN, what that's going to look like in the future, and also introduces the child to another person who is a trusted and knowledgeable adult, yes, in their lives that they can go to with specific questions. Now, in terms of when to worry, so if you start noticing some of these developmental changes, so breast development, but specifically menses or having your period before age 8, that is not normal and needs to be evaluated by a pediatrician and endocrinologist. Equally, if by 15 there's no breast development or no menstrual cycle, needs to be evaluated by a pediatrician. There are a lot of things that can cause both of these extremes. But when we see those, we get a little bit more heightened evaluation of what may be going on that's causing these kind of extremes of age in what we consider the normal puberty curve.
Okay, that makes sense. Well, and as we notice the changes and talk with our daughters about them, how can we support them through what's really sounds like a pretty up and down part of their life?
Yes, very up and down part of their life. And so I think being an open avenue for communication, to be able to ask questions in whatever form that is, if that's directly, if that's writing, however your child chooses to communicate, so that they know they can ask you questions. The other is making sure where they're getting their information. So everything happens, at school and aftercare programs, sports events. But one of the things that is very different than when you and I were in puberty is the advent of social media. And so making sure that they are not getting all of their information from social media, because what is out there is not always true and correct. And it it puts a artificial, fake, not realistic expectation for a lot of things in their minds. And as we talked about, their brains are actively changing and molding and trying to figure out which way is up. And so limiting the amount of information that they are exposed to before they're ready and before we can validate it is something that I would really, really encourage parents to be very aggressive about.
I think it's like you need to be their North Star, their
Yes.
true north for this kind of information, not strangers on the internet.
Correct. Yes. Yes.
Well, how have you seen the conversation around puberty and menstruation change over the years? And what are you excited about for the future of that conversation?
Yeah. So I think since we were going through all of this, the conversation has become much more open. I mean, it is part of mainstream now, which I think is wonderful because it removes the fear, the shame that's associated with keeping everything closeted, right? Keeping the tampon in your pocket and don't let anybody see it, way we all grew up. And so recognizing this is a normal part of life. Everybody experiences this. There's no shame in this, I think is something that's much different from before. I also see the advent of a lot of our technology as being a blessing and a curse, right? So patients come to me all the time complaining of abnormal bleeding, and I will ask about, okay, tell me when your last cycles were. And 9 times out of 10, if they are below the age of 40, they will pull out their phone and show me on that app. Okay, it says this, and this. And so it's a helpful as a physician to be able to validate that, okay, this is when their bleeding pattern is, and this is kind of the direction that pulls me in making clinical decisions. And so I think especially for adolescents who are just kind of all over the place sometimes, having that technology to track their cycles to say, oh yeah, I thought my cycle was a month ago, but it really looks like it was probably 3 months ago. Do we need to talk about that? Like what's going on? Is a way that you can catch things potentially a little bit earlier, or also to say, hey, this is in the normal range. because everything is a range, even cycle length and time between periods. And so to say, it may be every 23 days for a few months, but it goes to every 32 days, and technically that's still normal. And just that reassurance can be helpful. The flip side of that, like we just talked, is about the role of social media. So, as many times as people pull out their phone to show me their app tracker, they will say, "Well, I heard on TikTok," and I am very, want to hear the information that they have. But in hearing it, most of the time, it's not anything that is clinically true. And so being able to dispel those myths of this one person that I saw one time on this 15-second video said X, Y, and Z, um, is something that we really, really, really have to be careful about. And that makes me a little nervous. Um, because of the information that's out there that's not validated. But I think in general, being able to talk more openly about our bodies and what's happening is something that's much different for me than what I experienced. And I think can only be beneficial.
You mentioned ranges, and so puberty happens at all ages. What would you say to girls who maybe start early, start later, and they're around friends or they see other friends getting this or not this, and they get embarrassed? How do we kind of talk to them about it? It happens differently for everybody.
It's hard. It's not an easy conversation, and it's a continual conversation because again, none of these things happen overnight for positive or negative things. It's a continual up and down change. And so I think just continual reassurance that your time is coming. It's a range for everyone in everything. And this isn't just puberty and your period. This is grades. This is sports. This is kind of the general outlook of what life is like. And being reassuring and not dismissive of their fears. I think that's really, really important because I think they really just want to be heard and make sure that there's not something wrong with them. So reassuring them, sharing your personal stories with them, I had my period at this time. My sister didn't have hers until this time, and I was so worried. And I talked to my mom, and this is what she told me. And so I know exactly what you're going through, and we're going to get through this together. Um, is important. And also for the child or adolescent, encouraging them to journal or write or ask questions in a way that they can kind of get those feelings out. Um, Even if they're not having that direct conversation with you, just putting it on paper helps alleviate some of those fears.
This age is really ripe for self-conscious body image issues. How can we be sensitive and empathetic and supportive when they're starting to wear bathing suits or they're starting to wear bras and they're at friends' parties, and how do we get through this together?
It's hard.
Yeah.
And I'm on the cusp of it as well. So we're, all in this together. I think two two or three things. One is making sure that, again, we are there for them. We are acknowledging their concerns, we are validating them, and we are normalizing that it's a range for everything. I think the second is being very cognizant of how we say things is very important in our adolescence as their brain and emotions are developing. So you may notice that their clothing size changes every month. And so if you are, as difficult as it may be financially to get new clothes, making sure that you're not shaming or belittling or really kind of fussing at your child for, oh, I just bought you shoes and I have to do this again. Like your feet, yes, your feet just won't stop growing. They internalize that and think, oh, well, I have big feet and now I'm going to be like the person with big feet at school. And so as parents, we need to be very, very cognizant, even if it is something very difficult for us, maybe not verbalizing that to our child. And then the third would be no social media. In this time frame of their brains developing and seeing, other girls that are probably all pixelated and photoshopped as to what the quote unquote normal is very disorienting for them. And so limiting, I would say, no social media during the adolescence phase. Um, but if it's part of their life, and I understand that, then limiting it as much as possible because it's those comparisons of ideal or of some ideal that's not realistic that I feel like is really where we've gotten ourselves into trouble.
One of my favorite memes is the difference between us in 8th grade dancing, like, in our computer room and, like, 8th grade girls now who are, like, look like supermodels. And, like, that's just so the cognitive dissonance is strong there.
Yes, and their brain is so pliable at that time, and so ripe for, being trying to perceive what is cool and what is normal, that when you're putting false information in front of them, it distorts normal development. And so I would just be very, very, very careful and limit that. And it's not an easy conversation because it is so uniform in society, but really kind of holding the line as the parent to say, there are some harms here and we're just not ready for it. So, let's talk about it instead or play a game, over checkers, over doing a puzzle, not just sitting down saying, okay, we're going to have the talk and awkward on the bed and hoping little brother doesn't run in. More of, let's go for a ride. Let's go get a snack. Let's do a puzzle and slowly kind of bringing those conversations up. Instead of, just letting them have the cell phone and see what happens.
See what happens, yeah. Well, are there any myths or misconceptions you would like to bust about puberty or girls' development?
Yeah, so, I think some of the things we've touched on already. So there's no normal, quote, unquote, or right time. The age range, as we said, 8 to 15 is still in the normal range of when to have breast development and your period. Height also peaks during that time as well. And so there's no normal. So if your child comes and says, well, I haven't had my period by this day, and everybody says if you don't have it by this day, then something's wrong. That's not true. And so those are some of the myths. One of the other things that I've really noticed a lot is we, as a society, tend to downplay how painful some patients' periods are. And so I've had many patients in my office just in tears because they say, everybody just said I was being dramatic. When in reality, they have a very difficult, painful process of their menstrual cycles that some can be normal, but a lot of it's not normal. If the pain is so much that you're missing school, you need to see a pediatrician or an OBGYN because it shouldn't be that bad. And if children or adolescents are telling parents that, then it's really on us to prove that there's not something bad going on. To listen to them, because once you dismiss it, it turns into a bigger snowball of, okay, but my body feels this pain, but they're telling me it's not pain, and I don't know how to put those two things together. And so that's one thing that I really see that we minimize, even women, adults, as well as adolescents. When they say they're hurting or bleeding through their clothes, those are things that they're not being dramatic about and really need to be evaluated.
I really like that, and you saying that about it's just being open and just not being afraid to say what's really going on and not letting, any type of shame or guilt
Right.
or concern about what other people think get in the way of you getting the right healthcare.
Correct. Yes, absolutely. And letting someone like me, an OBGYN or your pediatrician, trusted family doctor, to really say, yeah, what you're describing is in that normal range. Or this actually doesn't sound normal. We need to do a few more things and see what's going on. And here are some things we can do so that you are not in so much pain. Or, bleeding through your clothes or having to leave every month because you are ill around the time of your period, because I see that every day. And there's real, it happens. It's not made up. It's not in their head.
It's not drama.
Yes.
Tell me more about your children's hospital clinic.
Yes. So I, in October, started an adolescent gynecology clinic at Children's. In my previous work, I was a clinic director of the in my previous work, I was clinic director at a large outpatient facility. And at that time, we were getting so many referrals from pediatricians for these teenagers. So girls 14 to 18 who really are kind of aged out of a lot of the pediatric routine checkups, but really weren't sexually active or weren't ready for OBGYNs. And so I was really struggling to find a place to put these patients. And so now in this role I've been in, seeing the opportunity as a lake provider to provide resources for adolescent girls at Children's Hospital for management of pelvic pain, heavy periods, painful periods. Those are things that I manage at that clinic. It's 2 half days a month, and I work, with Dr. Badley, so in the same office space. It's been wonderful thus far, really, able to see a lot of patients and impact a lot of patients, that really just were kind of falling through the cracks. And so patients can call and make their own appointment or can be referred in from their pediatrician.
That sounds like such a much needed resource. I'm so glad to hear that. And so it's for you may not necessarily be having any problems. You could just kind of
Correct.
call and just like a normal GYN appointment if they're just
Yes.
not ready for the adult appointments.
Correct. And what I tell most patients is very rarely in any of these clinics do I actually have to do an exam. That is usually the most concerning part. And once I tell the patient, we're just here to talk, I don't necessarily need to do an exam, you can just see their whole body relax. Um, because they're so apprehensive about that. And that's completely understandable. And my job is to make them comfortable while also dealing with whatever their ailment is, or just starting conversations like we talked about today.
And then they could transition to you in the adult side.
Correct. Yes. Yes.
Continuity of care. I love it.
Exactly. Yes.
Well, thank you so much for joining us. I
Yes.
really appreciate your time, and I can't wait to share this episode with everybody.
Thank you so much.
Thank you again for joining us, and thank you to Dr. Boggs and Dr. Hutchinson for talking with us about sometimes these sensitive topics, but I'm so glad we could get through them with you. If you know anybody who would be interested in this episode, we hope you share, and we'll see you next time on Parenting You.